So, you are experiencing a little bit of pain, I read in the notes.
Yeah, right here. And
yeah.
Yeah.
Okay, and just turn your head slightly. And is it a shooting pain? Is it localized just here? Do you feel it anywhere else?
Sometimes sort of shoots into my eye on that right side.
Okay, I'm so sorry you're experiencing that. Right. What I am going to do is have a feel of your head overall. Okay, I'm going to feel for any lumps or bumps. I'll ask you a few questions as well. And then I'm going to just explore the facial nerves just to make sure everything's working as it should. Okay. Did you fall and hit your head? Is this a new thing?
Not that I can remember.
Okay.
It's been about a week. Just sort of started one day, got a little bit worse over time.
Okay. All right. And does it hurt if I press?
It's a little tender, yeah.
Okay. All right, then if you just turn your head slightly. Thank you. So I'm just going to have a look, actually. See if there is anything visible. Okay, just so I can get some better light. Is that comfortable to hold your head there? Okay. Alright, doesn't seem to be any blood or any kind of open wounds. Is the hair sensitive at all when you're brushing it?
Not really, it's only when you push on it.
Okay. All right. Let's just have a look at the other side. If you could just turn your head, that's great. Okay. So, again, I'm just looking for any redness, anything that looks sore, and I'm just going to try and compare that to the other side. Okay. Any other unusual symptoms, disturbed sleep, strange dreams, anything like that?
Maybe a little trouble sleeping lately.
Okay. Do you take anything to help you sleep?
No, I'll just drink some chamomile tea every once in a while.
Okay. Okay. I'm just going to have a physical exam now and use my hands. I'm really sorry if it does evoke any pain. Okay, I'll try to be as gentle as possible.
Okay.
So you can just keep it straight now. Okay. Just feeling along this bone. Just really checking the symmetry and trying to feel for any fluid build-up or swelling. Any pain as I'm pressing there?
No, just a bit of pressure.
Okay. Can I just get you to swallow? Okay. I'm just feeling in front of the ear. There is a very large nerve that sits here and here. Sometimes, if there is an issue with the nerve, we can feel pain radiating across the head. So, any pain as I'm pressing here on either side?
I don't think so. No.
Okay. You may be feeling a little bit sensitive to pain at the moment anyway, which is completely normal. So I'm just going to pull on the ears slightly. And that's not triggering any pain, say at the back of the tongue or in the ear?
No.
Okay. Alright, just moving on to the jaw. We have lots of connected muscles in the face. So we have some that connect the ear area on this side as well. And we also have a thin layer of muscle across the scalp. So there can be some pain that radiates. Feel free to just close your eyes. And ideally I'd like you to just be feeling for any sudden or unusual sensations. Do you clench your jaw?
A little bit, yes.
Okay.
It feels a little tight in there.
Yeah, I can feel it. Okay, I'm just going to get you to turn your head. I'm just going to have a feel on this side only. Now, I'm just going to use this tool. Okay. Any sensitivity there?
A little bit. I think just where I clench my teeth, where I grind a little bit.
Okay, let's have a look on this side.
It's not as bad on that side.
Okay. Let's have a feel of your glands. Okay. Any sharp pains on the shoulders there?
None.
And on the chest area?
No, it's okay.
Okay. All right. Now I'm just going to check the temperature inside your ears, make sure there's not an infection in there. Okay. Okay, perfect. Perfect. Okay, that looks great. Alright, I am just going to have a quick look with the light. Just checking for any redness, obvious signs of infection or bleeding. So that looks fine. And that side looks fine too. Okay, while we are here, I'd just like you to just look at the light there. And just a quick check. Okay, that looks fine. And while we're here, I'm going to just check the back of your eyes. So if you could just look straight ahead. Okay, and the other side. Okay, all looks great. So, what I'm going to try and do is trigger any pain that might move down to your eye. That will help me understand whether it's a nerve-related problem or if it's something more localised, okay? So I've got a variety of tools here that I'm going to use. Hopefully there'll be no pain, but if there is, please do let me know. Okay, alright, so feel free to close your eyes.
Oh yeah, right there.
Yeah?
Causes a little discomfort down into my eye.
Okay.
That feels okay.
Mm-hmm. And do you feel it move, or is it pain here, then pain here?
I can feel it move.
Okay.
Yeah.
Okay. I'm just going to turn your head slightly. There we go.
Maybe a little bit
there.
right in that same spot.
Okay, I don't want to hurt you there, so I'm just going to place a vibration against this bone here and just tell me how it feels.
Okay.
Can you feel the vibration?
Yes.
Here?
It's getting fainter. I can feel it.
Okay. Yeah?
Yep. Just faintly.
Okay. Any pain around the eye as I do this?
No, it's more like the back of my eye where I feel it.
Okay. Right, I think there may be some bruising, okay, and it's very normal for you to feel pain travel. Sometimes the nerves can just get crossed a little bit and it can cause pain that travels down.
Okay.
I don't think it's nerve related because you mentioned you can feel it kind of shooting. Mm-hmm. Nerve related pain would kind of feel like an electric shock. And you'd suddenly feel it in the eye or simultaneously at the same time.
Yeah. Okay.
What I'm going to do just to clarify that is just check your facial nerves, if that's okay.
Fine.
So can I just get you to just replicate my facial expressions? So, okay, do that again. Okay, relax. Okay, don't let me move them out. Perfect. Okay. Perfect, relax. Alright. This looks quite sharp, but I promise you it's not that bad. Okay. I'm just going to run this across the face. Feel free to close your eyes. And what I'm looking for is any numbness. So any areas where you don't feel anything. That all feel okay?
Feels fine, yeah.
Okay. So we're going to do a slightly different sensation now, okay? So you can look straight ahead, close your eyes. So I'm just applying some pressure. Any pain or uncomfortableness?
Not yet. Just a little bit of pain there, that same spot. But it feels the same.
Okay. Okay, I'm going to take a couple of measurements on the head. If you just look straight ahead. I'm doing this just to monitor any swelling. Now, I'm not saying that there will be any, but if it is bruising, we would just want to make sure that that is all it is and it's not going to get any worse. Just turn this around. So I personally think that within a week or two the pain will start to subside. Okay. So 50, 54. Okay. And let's just check the neck as well, just in case. It's 34. Okay. So I'm conscious that you're in a little bit of pain, so I don't want to continue to poke and prod you. So what I'm going to say is to try to keep the area clear. Don't try not to knock it again, might make it worse. Don't put anything on it, okay? Let it, because if there is going to be swelling, you need to allow space for that, okay? If the shooting pain into the eye gets any worse, or it suddenly starts to feel different, just come back and let us know.
Okay.
But I am pretty confident that it is going to resolve in a week or two.
Perfect, thank you.
All right, well, it was lovely to see you. Okay,
Yes.
hopefully I don't have to see you too soon and that you get better. All
Thank
right?
you so much.
Okay.